Good morning. So today's show is going to be again about healthcare. It's the last in my series. Last week we talked a lot about healthcare. And so today I thought I would start out by saying to all of you, what scares you the most about your health? Because they tell us that if you have your health, you have everything. It's a blessing, and it is. Good health is a true blessing. But what scares you about health? Now, if you ask people from all over the world, people from Europe, from Canada, from Jamaica, from anywhere in the world, what scares you? They will say death because most people are afraid of dying. And then the second thing that probably scares them is, of course, cancer, getting cancer. If you ask Americans what scares them about health, you will hear different answers. You will hear losing everything we've worked for to pay medical bills. Now, see, the people in Europe and Canada, my viewers in Europe and Canada, and in every other really free nation in the world, they don't have to worry about that. If you ask people, why don't you go to the doctor? Now, of course, many times you will get the answer that I give. I don't like doctors. I don't trust doctors. I don't trust the results. That's me. But if you ask many, many Americans why they don't go to the doctor, because we can't afford it. No one in Europe or Canada or Jamaica will tell you they can't afford to go to the doctor because they have national health care. They don't pay anything when they go to the doctor. Why don't you go to the dentist? Well, I don't like dentists. Yeah, you might hear that. But why don't you go to the dentist in America usually means you can't afford the dentist. Because even those of you with insurance, health insurance, don't have dental insurance. And dentists aren't cheap. They're very expensive. It is expensive to have good teeth in America. It is not as expensive to get a cavity filled or to get dental checkups in Europe and in places where they have national health care. Something we've learned. Something I've been talking about for decades. That in America, for some reason, you only qualify as an American citizen with rights when you live to 65 years old. And now in society, it's 70 years old. If you're holding on to your social security card and saying, ooh, 65, oh, please, you better start thinking 68 or 70. When we are born as American citizens, we are issued a social security card that we can't use until we are old. And I'm not saying 65 is old, but you know what I'm saying. Wouldn't it be so much better for all those people who haven't lived long enough to collect their Social Security that they pay into every paycheck? Wouldn't it be better when you're born to be issued a national health care card as an American citizen? And when you start earning an income, just like we pay into Social Security, you get a small deduction, a percentage of your salary, deducted to pay into your national health care. But you have been able to use that national health care your entire life, not just hoping you live to be 68 or 70 and collect your Social Security benefits. And you all know who are on Social Security, they ain't that great. Not like you can live on them. Wouldn't it be better if we had that sort of system here rather than people fearing the day that they get diagnosed with a serious health condition and they fear that everything that they went to work every single day to buy their home, to buy their second home, a vacation home, that they could lose it all simply because they had the bad luck of getting sick. And insurance won't cover everything. Isn't it sad? that because of bad luck or God or fate or whoever you want to blame for it, that in America you can lose everything you're working for right now. That you get out of bed this morning, you went to work, you can lose it all. If you or your wife or your children or your husband gets a serious health issue, you can lose it all. Is it really worth living if it means you have to sell your house or you have to change your lifestyle to get well? Only in America. Only in America. So this is what people fear. Most people say they fear cancer, and I'm going to tell you this. Cancer and death is not the worst thing that can happen to you. And I know this from experience and from hearing my wonderful viewers' stories of what they live with day to day. And it's not cancer, not even life-threatening. It's life-altering. And what doctors and health insurance companies will allow American citizens to live with rather than to cure, it's reprehensible. And we're going to keep going with this. So first of all, my grandmother always used to say, I don't fear death. I fear the suffering that comes before death. And she was right, because for many years she did suffer before she died. And she never had cancer, by the way. Everybody says, oh, cancer, it's the worst thing that can happen to you. Actually, it's not. I mean, it's bad. It's horrible. It's life-altering. But there are many other illnesses that, by the way, are not being diagnosed or treated that American citizens live with, and some of my viewers live with every single day. And the worst part is when some of these illnesses don't have a name. And if they don't have a name, they don't have a treatment or a cure. Then we have the illnesses that have a cure that insurance won't pay for, or doctors refuse to perform. Talk about both. Let's start with the undiagnosed, but there's something wrong with me illness. I talked to a viewer this weekend. She's walking with a cane. She has chronic pain every day of her life. And she's had every test, every MRI, everything under the moon, but there's nothing wrong with her, according to the tests. But this woman suffers every day with chronic pain. And her life is altered because of her pain. And because they don't know exactly what is wrong, they can't treat it. This is her new normal. Many people live with chronic illnesses that have no name. And if they don't have a name, there's no magic pill, there's no procedure, there's no treatment. So they live with this every single day. They have had endoscopies, they've had PET scans, MRIs. Okay, you don't have cancer, you don't have this, you don't have that. We don't know what you have. So you're just going to have to live with it. And it's painful. It is painful to know that tomorrow you are going to wake up and you're going to be in excruciating pain and you can't go to the doctor and you can't go to the CVS or the Walgreens because there is nothing available to fix it. Because it doesn't have a name. That's bad. That's something we all should fear. There's another issue we should fear, and that is illnesses or problems in our bodies that our doctors know that we have, but we're not allowed to have the cure. And this is my personal story. When I was 7 years old, I knew what a fibroid tumor was, and I knew what a DNC was at 7 years old. And that is because my mother, like millions of other American women, suffered from severe fibroid tumors. Now, let me tell you what it's like to live with fibroid tumors. For all you ladies out there and the men who love them, you get like annoying periods once a month. A person suffering from fibroid tumors doesn't know when or how bad. First of all, their periods are horrible, but they can start bleeding at any time in the month. And this is what happened to my mother. From as little as 7, 8 years old, I remember that mommy had to go to the hospital. And I remember seeing blood stains on her sheets, blood stains on the carpet, because mommy was bleeding out of her lady parts. And at 7 years old, that meant mommy had to go to the hospital. And what mommy had done was a D&C. Now, what mommy actually needed, because the only cure for fibroid tumors is a hysterectomy, which means they remove the uterus, which is where the fibroid tumors grow. Okay? So she would go for the D&C, and she'd come home, and she'd be okay for a year, maybe 2 years, and then she would start again. More blood-stained sheets, more running to the bathroom with blood running down her legs, going back to the hospital, another D&C. 12 times. 12 times. They kept saying, well, you know, my mother was not the kind of woman to question her doctors, because all of her cousins that were her age, they had already had hysterectomies. But what started happening around the time when my mom had her fibroid tumors was insurance companies were saying that hysterectomies were being done too often and unneeded surgeries. And they got tired of paying for them. So they basically said, well, the D&C is cheaper and it doesn't throw the woman into menopause. Now, let's talk about menopause for a minute. We've done this before. Back then, and even today, menopause is considered a curse and a disease instead of a natural process. I am menopausal. I am in menopause. I'm done. And I love it. I'm a happy, very free-living woman because of menopause. But doctors will tell women that the worst thing that can happen to them is going through menopause at age 40. Even if they don't want any more kids or never wanted children. The worst thing that can happen to you is going through menopause. Well, you know what? I think the worst thing that can happen to a woman is being at a restaurant with her girlfriends and hemorrhaging all over the seat in the restaurant, which is what happened to my mother at age 68. 25 years of having D&C after D&C after Band-Aid procedure and Band-Aid procedure, which is what a D&C is, for her fibroid tumor disease, which is not cancer. If it had been cancer, she would have had a hysterectomy, boom, like that. But because it's not cancer, they sent my mother home for 25 years to live with blood-stained sheets, blood-stained carpets, running to the bathroom with blood running down her legs, passing blood clots in the toilet the size of tomatoes. And I saw them. Having cramps that put her in bed, barely able to move. That was okay to live with. But God forbid she goes in and has a hysterectomy where they remove her uterus and maybe she goes through menopause 5 or 6 years earlier than she was supposed to, naturally. It's okay to let a woman live with that. And I have talked to some other viewers who are living with fibroid tumors and they're doing the same thing to them. Anything but a hysterectomy. God forbid a woman gets sterilized. Take out the reproductive organs and a woman just becomes a piece of garbage, according to our society. If you cannot birth babies in this country, if your reproductive organs don't work, you're nothing. Even in 2017, almost 2018. I experienced it myself, and my mother died because of it. At 68 years old, January 1st, my mother calls to wish me Happy New Year and says, oh, by the way, I'm bleeding again. See, they told my mom when she went through menopause, the fibroids would shrink. And she went through menopause early, at around 45, 50, and she had no issues. But at 68, she woke up on New Year's Day in 2004, and she was hemorrhaging. And she called the doctor the next day, and guess what they wanted to do? A D&C. She's 68 years old, and she's in menopause. And they said, let's do a D&C. Well, guess what? They couldn't do a D&C because she had had so many D&Cs in her lifetime. Her cervix grew shut. They couldn't even get up there to try. So this was January. And she's hemorrhaging on a daily basis, hemorrhaging to the point where she had to take iron pills. And it took until April for them to say, maybe we should do a hysterectomy. And then where do they send her? They send her to a cancer doctor. Now you have to remember, they couldn't do a D&C, so they didn't know why she was bleeding. But she has a 25-year history of fibroid tumors. No, we better send you to an oncologist. So here's my mother going into surgery thinking she has uterine cancer. And thank God, because her surgeon was excellent. Again, remember, her hysterectomy surgeon did not kill her. Okay? The hernia surgeon and the doctors and the nurses who gave her heparin probably killed her. But the bottom line is she had a great surgeon. The problem is, though, she didn't have cancer. And after the surgery, Dr. Evans came out and said to us she did not have cancer. The one thing that was interesting was they didn't actually, she said, well, that uterus needed to come out, but they didn't say why. But see, I have my sources. I do know why. I know for a fact why. And that's going to be the end. That's going to be the end of the show. But wait, you got to wait for it. So finally, my mother was allowed to bleed out every single day, hemorrhage, be afraid to go out of the house. She was wearing all kinds of protective garments to try to not bleed in public. 4 months. January, February, March, April. They say, okay, you know what? We tried the D&C, which they charged her insurance for. Couldn't do that, so that didn't work. Let's do a hysterectomy. We were thrilled. Finally, after 25 years of my mom needing a hysterectomy, she's getting one. And what we didn't count on was, again, the doctor that was supposed to remove the hernia not showing up that day, sending someone who never met my mom, her bowel getting nicked during that hernia surgery, and of course people giving her heparin and possibly the wrong dose. And so she had a lot of complications and she died. And once again, we knew mom needed the hysterectomy. We knew my mother should have had a hysterectomy when she was 41 years old. What I never was told was what was actually wrong that started this bleeding issue in January of 2004. But I had somebody that I knew, and of course I'm not saying names, who actually accessed my mother's medical records, the files that I didn't get to see. And what actually happened was that my mother had a grapefruit-sized fibroid tumor in her uterus. The good old fibroids were back with a vengeance. And they killed my mother. Now, it took 25 years for fibroid tumors to kill my mother. So for you ladies out there who are told you have fibroid tumors, you better make sure your doctor does something about it. Instead of just saying, you're just going to bleed a lot whenever they act up. And we'll do a D&C and put a little Band-Aid on it. Because a D&C is basically dilation and cauterization. They go up there, they scrape the uterus, and then they stop the bleeding for a temporary amount of time. And it comes back because fibroid tumors are only cured with a hysterectomy. You have to remove the place where the fibroid tumors grow, which is the uterus. That's the only way you ladies out there with fibroid tumors are going to never have to worry about this again. And that is my story. And I stand by it. I experienced it. I know that when I was 11 and I got my period for the first time, I was horrified because I had watched my mother for 4 years from the age of 7, hemorrhaging and bleeding. And I'm like, oh my God, this is going to be me now. Because I didn't know anybody else, and people don't talk about it. So this is what I want to tell you, you ladies out there, and the men who love women, your mothers, your sisters, your nieces, your aunts, your grandmas, everybody. Women and people who love women. Don't be afraid to ask questions. My mother never had the internet, and she trusted doctors like they were gods. Doctors are human. They make mistakes. They are not God. Don't be afraid to go on your own and research what a doctor is telling you. If you don't like the treatment you're getting, go to another doctor. You don't have to stick with one doctor. You can get other opinions. I'm so glad that I did. Talk to each other, you ladies. When I had my cervical cancer scare, if I had not talked to other women before I had it, and I had heard other women say, well, yeah, I had abdominal pap, it's no big deal. You just get another one in 6 months, and it's usually no big deal. It's a mistake. But then Planned Parenthood goes apeshit on me and says, oh no, you need a biopsy, and you need cryosurgery. They didn't even admit that their lab could have made a mistake. Now that was a año horrible, a horrible year. But in my moments during that year of clarity, of sanity, when I could think, I thought, wait a minute. I have been treated differently. Obviously, something's wrong. They never did the HPV test. So they can't tell me I have HPV. So as of right now, I don't have HPV. My husband is healthy. All of his ex-girlfriends are healthy. The good chance is this is a mistake. And then, of course, I would go into that deep, dark depression where I'm thinking, my God, they did a biopsy. They wanted to do surgery, Band-Aid surgery, not the good stuff that takes the shit out, of course, because insurance wouldn't cover that. And God forbid, at 41, 42 years old, I can't have children, not to mention the fact that I've been paying, hundreds of dollars for birth control for 30 years to prove that I don't want kids. But God forbid, they don't want to do anything to mess me up for having babies at 41. I went through all this. And all I thought about was my mom. 25 years of having a condition that could have been cured when she was 41, 42 years old. And if that had happened, I believe my mother would be alive today. I absolutely do. So those doctors 25 years ago, and I know who he is, he didn't bother to even show up at her funeral. Her family doctor for 25 years did not show up at my mother's funeral. Barely showed up at her hospital bedside. D&C, D&C, D&C. You can live with fibroid tumors. It's just a little inconvenient. So for all you people out there, I hope what we've learned over the last week when I was doing these shows, first of all, know your rights. Remember the Affordable Care Act. It is still the law. If you want a preventative test, you go get it. And if somebody tells you you're not eligible for it, you remind them about the Affordable Care Act. We had that viewer who was told she was not able to get a mammogram for 5 years because she was 50 and the American Medical Association said so. And I did the research. They did not say that. And she got her mammogram, by the way, on Friday. So good for my viewer. She got her mammogram. And the insurance company is going to pay for it. She will not. Men out there, you can get a prostate exam. Remember I told you my husband was charged for his prostate exam. I called the provider immediately and said, no, Affordable Care Act. See, it works for women and men. If you are over 40, you men can get a prostate exam. No cost, no deductible. You know, insurance tries to take without give. So whatever you're paying for health insurance, and I'm sure it's too much, make them at least pay for what they are required to pay for. I don't like getting screenings, but when Highmark sent us a letter saying they were canceling our health insurance, we got a letter in November that by December 31st, they were canceling our health insurance that we had never used, but we had paid for, $5,000. I said, screw it. I'm getting a mammogram, and they're going to pay for it. So I scheduled my mammogram on December 29th, and they paid for it. And the girls were healthy, thank God. But I didn't get the mammogram because I really wanted a mammogram. I got it because I wanted them to pay for one thing. For Paula Luciano, who had paid them so much money all year. I wanted to make them pay, at least for something. And I did. And it felt good. And it felt even better to know my girls are healthy. Now, was I thrilled? Did I go out and have a party? No. Because I understand just because my breasts were healthy this time, it doesn't mean that my colon is healthy, that my brain is healthy, that my bones are healthy. I mean, I could have cancer anywhere in my body. The health insurance doesn't pay for chest x-rays or, PET scans to make sure you have no cancer anywhere in your body. So I don't know that I'm cancer-free. I just know that time my girls are good and we can move on. But it was really good to screw it to the insurance company. You didn't pay for me all year. You thought you were going to take my money and never give anything back. Well, you're going to give back. And they only paid $400 of the $600 they were billed. But they did pay. And I paid nothing. And it felt good. So please, talk to one another. Use the internet, which my mother did not have. And thank God when I had my cancer scares, I did have the internet. So I was able to research and talk to other women. Talk to each other. You know, people don't just go to lunch and say, oh, by the way, I had an abnormal pap smear last week. Ask, how are you doing? Did you have your pap smear? What happened to you? Learn from your friends' experiences. I know I did. I've learned a lot. My viewer who sent me this story about being denied a pap smear for 5 years by an insurance company, who quoted the American Medical and Association and the American Cancer Society? No. Neither group agrees with that. But Blue Cross Blue Shield sure tried to convince her that she didn't need a mammogram because they didn't want to pay for it. So remember that. Remember my viewer who got her mammogram finally on Friday and is not going to have to pay for it. Remember, and God help anybody at Blue Cross Blue Shield if, God forbid, there's something wrong in that mammogram she got on Friday. Because they have been denying her a mammogram for 5 years, telling her she wasn't eligible for one. As long as the Affordable Care Act is the law, men and women, depending on your age, you have to check, over 40 prostate exam for men, over 40 mammogram for women, every year if you want it. Every 3 years, pap smear and HPV test for women, paid for. And if you're healthy, over 50, first colonoscopy completely free, and then if you're healthy, every 5 years. No charge, no deductible. Know your rights before somebody who says that you can live with something that causes you distress or pain, or that you don't have the right to get tested for something before it turns into something you can't live with, or that you're going to die from. Know your rights. Make them aware that you know your rights. Love shows and grows, but there is one place where we don't need to show love. We don't need to love our doctors. We don't need to love any healthcare provider, and we certainly don't need to show love to our health insurance companies. We pay them to work for us. For us. They're not God. They're not the boss. We are the boss. So be the boss of your healthcare. Remind them every day who they work for, who pays their salaries, who buys them their country club memberships, their big fancy cars, and their summer houses. Remind them every day. Remind the health insurance companies who pays for their fancy offices and their $500,000 fountains in the lobby. Remind a hospital who pays for the baby grand piano in the lobby and the free internet and the big 50-inch screen TVs in every hospital room. Remind them who pays for that. And then demand that you are treated the way you want to be treated. And that you are never forced to live with something that can be cured. That you have to live with it just because some insurance company or some doctor doesn't think you need it. Get what you need. Don't give love to anybody but yourself. It's your body. It's your health. Take control of it. Look, this is my last show of the season. It's gone long, I know, and I hope you all have gone through to the end because I have to thank all of you. This has been the most amazing first season. I can't wait for the next season to start. It will be it will definitely start in November. I'm not sure the date yet. As you can imagine, I've got 5 months of crap to unload when I get home on Sunday. But I will work diligently to start the new season as soon as possible. We're going to have a new set. We're going to have a new schedule. And we're going to have a lot of awesome new topics. And it's not just going to be politics, guys. It's going to be social issues. It's going to be about you, about my viewers, who I talk to all the time and who I have had the privilege to meet in person, some of you, this year, and to email with and message with, and it's been a delight. I want to thank you for making my dream come true of actually being a talk show host. Now, of course, some people will say, oh, yeah, whatever, you're not a talk show host, it's Facebook. Well, they haven't seen my viewers. They haven't seen the Sharpie droppers and how powerful you are and how we stand up for each other when we're holding our Sharpies. So for now, Political Paula is out, and I can't wait to see you in the new season. Let's drop that Sharpie together.